And then there's the flu activity, typically beginning to increase in October. And this year, doctors say it's more important than ever to get a flu shot. They're once again warning of a twindemic, but last year, flu cases hit record lows. So we're going to bring in our chief health editor, Dr. Partha Nandi. Dr. Nandi, good to see you. Are cases expected to be higher this year of the flu?
So, Glenn, the flu season is notoriously unpredictable. That's why people complain about it. And yes, last year's season was mild, which is great during the pandemic, as relief because that's such high COVID case numbers. But many of us in the health field are now expecting the flu case numbers to go up this year. And here's why. Number one, right, public health measures have changed since last year. Why? Masks are no longer required in many states, including right here in Michigan. Social distancing has eased as well. So while there are people who continue to follow these safety precautions, which I really still strongly support, there are just as many who don't. Secondly, many people are gathering more often. There are a lot more kids back in classrooms this year, and more businesses have reopened, and more folks are traveling nationally and even internationally. Lastly, with less exposure to the flu last year, I'm also concerned that many Americans could have weaker natural immune defenses.
Recommendations for when people should get the flu shot, and what should we know?
And a lot of my patients ask me this. So to me, now is the best time to get the flu shot. Most people who are older than 6 months can get the flu vaccine. It takes about 2 weeks, right, for the antibodies to develop. But for kids under the age of 12 who are getting their first flu shot, they'll need 2 doses that are 4 weeks apart. And parents should know that it'll take about 6 weeks for antibodies to develop. As a parent, I know that kids can be afraid of needles, right? We all know that. So ask your pediatrician about the flu mist. The flu mist is a nasal spray that's been approved for people between the ages of 2 and 49. That's unless you are pregnant. If you're pregnant, you want the flu shot. It can help prevent severe illness and maternal complications. Also, for those age 65 and up, we've talked about this before, you likely need a high dose or adjuvant flu vaccine. These are designed to create a stronger immune response. Now, I'm getting also asked by my patients if they can get the flu shot and the COVID vaccine at the same time. This is a common question. And according to CDC, the answer is an emphatic yes. To me, it's important that people who can get vaccinated for both the flu and COVID do so. Both of these viruses are respiratory viruses, and they can both kill. We know that. Getting vaccinated, to me, is the best way to protect yourself and your loved ones. This is the time to get it done.
All right, Dr. Nandi, thank you so much. If you have a coronavirus question for the good doctor, you can email him at drnandi@askdrnandi.com, or you can send it to us on Facebook or Twitter. We'll get it right to him. Brian.